Hello viewers, welcome back to the YouTube channel of Yash IVF. Today we are going to talk about male infertility. Well, there's some good news and there's some bad news. The bad news first is that during the last couple of decades, the incidence of male infertility has been on the rise to the extent that now we see one male infertility patient for every female infertility patient. So it's equal now. The good news is that as far as male infertility is concerned, men can keep on producing sperm throughout their lives in most cases, which means that if their infertility is related to some factor which can be controlled, and if we can neutralize or eliminate these factors, then perhaps we can reverse the infertility. Today, we are going to look at some of these factors which can be controlled. Lifestyle, habits, nutrition, exercise, rest, these are factors which we are going to talk about. First and foremost, let's talk about your smoking and drinking habits. Smoking and alcohol should be completely avoided, especially during the time that you wish to start a family. Studies have shown that in smokers, the sperm count was almost 20% lower than men who were non-smokers. Similarly, alcohol also has a negative impact on the quality of the sperm. Within 2 to 3 months of stopping alcohol, we have seen the sperm count revert back to normal. So it's very important that smoking, alcohol, drugs, these are things that you must completely avoid. These habits have to change. Also, you have to avoid sexually transmitted disease or infections, especially during this phase during which you are trying to start a family. Let's now talk about nutrition. It is very important to consume healthy fats. See, we are in an age when people are trying to diet and avoid fatty substances. But what we must understand is that healthy fat is important, and try and avoid trans fats which are not good for your health. Vitamins like A, D, and E are absorbed through healthy fat. This is plentifully available in meat, fish, eggs, and for vegetarians, in cheese and in nuts. Different vitamins are important for the quality of your sperm, the production of the sperm, and these are available through the food that we eat. So it's very important to have a balanced diet, eat plenty of fruits and green leafy vegetables. However, there is one vitamin which is not available through the food that we eat, and that is vitamin D. For vitamin D production in your body, it is very important that you should expose yourself to the sunlight. After nutrition, we come to exercise. It is very important that we should exercise moderately. High impact excessive exercise is not good for your fertility, so avoid it. Proper rest is as important as exercise and nutrition. You have to ensure that you get a good 8 to 10 hours of sound sleep every day. So these are some of the factors which are entirely in our hands, and by eliminating these habits or modifying your lifestyle, you can probably get back to a situation where your fertility is back to normal, and good luck to you.
Wishful to Yashful.